Well, we're back right here in the studio, and we have with us right now Dr. Ashok, Medical Director at a private clinic. Dr. Ashok, welcome to our program once again.
Thank you so much. Privileged to be here once more with you.
Nice to have you, sir.
Definitely. It's always a pleasure to have you with us on Hala.
Thank you so much. Thank you.
So, Doctor, today we're going to talk a little bit about the post-COVID-19 condition.
Yeah.
So what is that exactly? Tell our audience, please, sir.
Yes. Let me give some
sure.
little bit of introduction.
Go ahead,
before
sir.
that. I have to go back to a nightmare that went for 2 years.
Yeah.
More than 2 years,
yeah.
actually. And it has not still stopped yet.
No.
And as it is named COVID-19, so it started at the end of year 2019.
Exactly.
And it played a havoc in almost all over the world throughout 2 years and more than 2 years. And after that, after 2, 3, 4, 5 waves, it came one after another waves. And in some countries it stopped after 3 waves. In some countries it went off for 5 waves. And thereafter we are now free from mask, free from sanitizer, and we are forgetting to wash our hands frequently, and social distancing, forget. So everything is cool now.
That's great.
Now post-COVID condition is such a thing that when a person is affected by COVID, usually it goes off within 12 weeks. If it persists more than 12 weeks, then the condition is called post-COVID condition, or long COVID, or long haul COVID, or chronic COVID.
What is that, doctor?
That is the symptoms are persisting still. You are maybe PCR negative, and all tests are doesn't reflect that you are still affected, but still symptoms are remaining.
Which are what to look for this post-COVID?
Yes, you have some symptoms like sometimes the fever is shooting up, body pain, arthralgia, chest pain, and shortness of breath, and cough, extreme tiredness, and it persists for more than 3 months, more than 4 months even, and it is called chronic COVID, and we have to take care of this condition, and we must not ignore it. This is called post-COVID condition.
Okay.
Yeah.
That's really great. So when it comes to the vaccines, when it comes to the conditions of post-COVID-19 condition, do they protect us or prevent?
Yes, very
anything?
good question. The vaccines actually were our only protector. When we were living in the nightmare, every moment was fearful. Then vaccine gave us hope, and the vaccines like Pfizer, this AstraZeneca, and this all the vaccines gave immense immunity and protection to us, and we have achieved herd immunity. That is more than 80%.
Great, that's great.
So once you are vaccinated, then immunity is more than the average individual. So obviously these people who are immunized properly, such as I have taken 4 doses, first booster, second booster. If
That's
you have
great.
taken the whole course, then you are more protected, and you have less chance to be going to the stage of post-COVID-19 condition.
That's
There
great.
is less chance.
Yeah.
What about, doctor, for those recovering from COVID-19? What should they do?
Yeah, they have to be. The thing is that they have sometimes depression, anxiety. They lose their sleep, and as I told you, many symptoms are there. They have to avoid the mental stress at first. How can they avoid these WhatsApp messages?
Yeah, it's
Facebook messages.
ongoing.
They are very alarming.
Social media, yeah.
Yes,
Exactly.
very alarming. To avoid this, to avoid a very stressful movie,
Yeah.
hot arguments. So
Exactly.
avoid stress. Good food, healthy good food, healthy lifestyle.
Nice.
And if fever comes, a little bit of antipyretics, means paracetamol, like these things.
That's fine a little bit.
And to increase immunity, he can take the vitamins and other antioxidants like this.
That's really great. So when it comes, we'd like to know more when it comes to the symptoms of post-COVID-19 condition. We would like to go deeper into the symptoms, please, doctor.
No. We are confusing sometimes with the sequel of COVID and post-COVID condition. Complications of COVID-19 is different and post-COVID is different. Post-COVID is a chronic situation of the main disease. It goes longer, but complications are different, because you know that at that time of COVID, there were many hospitalization, ICU admissions, deaths. So if you have the comorbidities along with the COVID, there was less chance of suffering, and this COVID-19 condition is usually subsiding after a span of definite period, like 3 months, 4 months, like this.
Definitely.
Nothing to be afraid of.
Nothing to be alarmed.
No,
Exactly.
no. It's not a very alarming thing. Post-COVID is a chronic condition.
Exactly.
So talking now a little bit about stress relief from COVID, how can this be achievable, doctor?
Yeah. Music is one of the best things.
It's nice.
And if you can afford to do, then traveling is another advisable thing. Another thing, when there is shortness of breath, chest pain and other things, then respiratory exercise, one of the portion is yoga. It's very useful, and if the COVID-19 person affected by COVID-19, chronic case, this COVID-19 condition, if he practices respiratory exercise regularly, indirectly he can avoid stress.
Exactly. Exactly. So you, doctor, mentioned the social media.
Yeah.
And, social media, sometimes it can cause a lot of psychological effects, such as disconnection, anxiety, and things similar to it.
Yeah, yeah.
So is there any post-COVID conditions affect the psychological part of the person, like deeply affecting it?
Yes, yes, of course. They are vulnerable to get affected by any intense mental pressure or any hot argument or any fearful things which may create tension, or any
something provoking,
something related with this social media messages. I am not mentioning about the specific social media.
Yeah.
So
Also the internet, like we
Yeah.
cannot live without the internet now.
That's
Yeah,
right.
yes. The Google messages are more authentic. But still, those who are affected by COVID-19 should not search out what is going on.
Yes,
Yeah,
that's true. It
that's-
can be
It's irritating.
difficult and
Exactly.
deceiving,
Exactly.
Ahmed. So how soon after COVID-19, doctor, can someone be confirmed to have post-COVID-19 conditions, sir?
Yeah, that is what I am telling you. Usually the patient gets relief within 12 weeks. If it lingers more than that, then we can think about that it is turning to be a post-COVID-19 condition, and we have to go for some tests for him, like blood test, like chest X-ray and sputum test, or any usual tests. And the most importantly, it affects the blood circulation. It may create internal thrombus, so we can go for finding if there is any thrombus or not inside. So whether his blood circulation is okay or not, because sometimes it affects heart also. Sometimes it affects lungs directly, making the fibrosis in some parts of the lungs.
Well,
So in this way we can find whether how much he is affected.
exactly.
In that way we can treat him.
Excellent.
Well, that's really amazing information, doctor, when it comes to the post-COVID-19 condition.
Yeah.
Which some people, they might think it's only a matter of healing and there won't be any side effects later. Thank you so much, Dr. Ashok, for this wonderful information you shared with us.
Thank you.
Thank you for joining us this evening, doctor.
Thank
Wish
you.
you all
Thank
the
you,
best.
Thank you, sir.
Thank you for coming. We'd like to thank our guest this evening, Dr. Ashok Deb, medical director at a private clinic right here in the state of Kuwait. Now we're going to go on to another one of our reports, and it's dealing with fine arts. Stay tuned.